What are the absolute contraindications? A personal history of estrogen receptor positive breast cancer. Personal history, not family history. Even if you are high risk, you are still a candidate for a consideration of hormone therapy. Personal history is a contraindication is because there's mixed evidence with respect to what adding estrogen therapy does to a pre-existing tumor. It's never say never, but you definitely want to see someone who's very experienced if you fall into that category. History of endometrial cancer, same situation. Personal history of a cardiovascular event, so think heart attack or stroke. Venous thromboembolism, personal history of a blood clot in the leg, so a DVT, or the lung, a PE, or a stroke. It doesn't mean you can't consider transdermal estradiol, but I would avoid oral estrogen because it's metabolized in the liver where it interacts with clotting factors, so avoid it. Active or severe liver disease. I'm not talking mildly elevated liver enzymes. I'm talking cirrhosis or something on that level where your liver is not metabolizing properly. So that kind of makes sense. Pregnancy, you don't want to start hormone therapy if you're pregnant. Hypersensitivity to hormone therapy, like an allergy. And finally, unexplained vaginal bleeding. You always want to rule out endometrial cancer before you're starting hormone therapy, especially if you're postmenopausal or if you have risk factors. Okay, so those are the only absolute contraindications. Relative contraindication typically means you can consider hormone therapy, but lean into transdermal therapy over oral formulations. So number one, a migraine with a history of aura. Number two, hypertension that is well controlled, elevated triglycerides, active gallbladder disease, elevated body mass index, history of diabetes, elevated risk of cardiovascular events or venous thromboembolism. Sometimes women are told that if they have elevated lipids or they're on a statin, that they cannot consider hormone therapy. It is not true. The American Heart Association has clear guidelines. Women who are of elevated risk can still be further risk stratified to determine if they are a good candidate. Age and stage. Just because you're over 60 or 10 years past your final period, this is not an absolute contraindication to the use of hormone therapy. You may very well still be a great candidate. That's a lot to take in. I get it. But if you're somebody who says, oh, none of those things apply to me, great. You have a lot of options. If you have relative contraindications, you might want to ask for a trial of a low-dose transdermal estradiol with maybe a natural progesterone. If you have absolute contraindications, perhaps one of the newer medications that are non-hormonal but can still bring tremendous symptom relief.